Hi, I'm Shiv Gaglani, welcoming you to Raise the Line with Osmosis from Elsevier, an ongoing exploration about how to improve health and healthcare. I recently attended Grand Rounds at Hopkins by today's guest, Dr. Susan Mackinnon, and knew immediately I wanted her to be a guest on Raise the Line because she has such important messages to share. Given her pioneering work in peripheral nerve transfer and regeneration, as well as leadership of national medical societies, you'd expect the focus of today's show to be on her many professional accomplishments. And while we'll be touching on some of that, her passion and research is now focused on changing the culture and climate in the medical profession with an emphasis on finding happiness at work, spurring innovation, and the importance of self-care for providers. Dr. Mackinnon is a professor of plastic and reconstructive surgery and the director of the Center for Nerve Injury and Paralysis at Washington University School of Medicine in St. Louis. So Dr. Mackinnon, thanks for taking the time to be with us today.
Well, thanks very much, Shiv, and please call me Susan.
Okay, Susan. Well, I'd like to start where we always start with our guests, which is, can you tell us a bit more about your journey into the field of healthcare and then specifically into surgery?
My journey into healthcare and surgery. It was terrific. So it started with a fabulous teacher, Lou Bob, who came from New Zealand, and it was high school, and he taught history. And he was such a great, charismatic person and so wise and so engaged that I wanted to be a historian. And I'm thinking now, I don't know if I wanted to be an historian, but I wanted to be like Lou Bob. So he was a Maori Indian, went to London and Oxford, and then landed in Toronto. Oh, such a great guy. So I told him I was going to do this. And he said, why do you want to do that? And I said, well, because it's so repetitive. And if you just let people know what was going on, all this ego fighting over this and that, then we would get rid of all the wars and the world would be wonderful. And he said, you're very naive. You won't change anything. Do something practical. And then my practical was go into medicine where I'd always be good at a job and then I could help people. How great was that? So it was when I got into pre-med. And it was rugged. There were 8 women and the rest were all men. Queen's University, a top school in Canada. And I had a struggle getting in, apparently. The dean was Dean Botterill. He was a neurosurgeon and had led the neurosurgical in the Second World War. Wow. And he was the dean then. And I found a letter just last year in my father's papers about how Dean Botterill had said, no, she can't go into pre-med, even though she stood top in her class and was 20 points above some of the men, because she should just go into like other issues and have a happy life or something. So I got into, when I did get into pre-med, and I was 1969, 19 years old. And in the summer of that year, I was sitting in a small room on campus and a job at the university doing something in a lab. And I went to this lecture, and the same guy, Dean Botterill, was at the end of the table, about 10 of us. I remember exactly where I was sitting. He was over there. I was here. There was a window. I was looking out at the lake in Kingston. And he talked about the effect of norepinephrine on spinal cord injuries. And I was just fascinated. So he was a big part in my journey in nerve. And then through medical school, I did every single nerve rotation I could do: neuroanatomy, neuropathology, neuroradiology, everything. And I knew I was going to be a neurologist. And I stood first in my class over the 4 years, never first in any year, but cumulated over the first in my class. And I had matched into an internship in medicine and planning to do neurology. But I just had my baby on June the 18th at Laughlin, my first child. And I wanted to have my week vacation at the beginning of August. We have a camp up in Northern Ontario, still have it. And I wanted to take Laughlin up to meet my family up there. And I made an appointment. How bold was I? With the Dean of Medicine, Larry Wilson. And I said, I'm entitled to this time off, and I'd like to take it in August because that's the only time that ice is off the lake. Literally, ice is on in June and it starts to snow in August. Well, now with climate change, not so much. But he said to me again, maybe you shouldn't even be in medicine. Like, have your priorities. I understand your priorities, but, patient first here. And I thought, I don't want to work. In my mind right then. I remember exactly where he was sitting, where I was sitting. I still don't know how I actually got a meeting with the dean, and I thought, I don't want to work for you for 5 or 6 years. And I had got the professor's prize in surgery, and Alan Crewis, who was a friend of mine, decided he didn't want to be an intern in surgery because he wanted to be an ophthalmologist and didn't like this surgery stuff. So we switched. And then I went into surgery. And then I had a similar path. I've had the same experience all my life. These weird things happening, big problem, and then it's not a problem. And it's a good problem to have because then it moves me somewhere else. Is that good enough?
Yeah, no, I love that. There's a couple of takeaways from that. One example is like how your interactions and attitudes with someone can change over time. Like, for example, the first dean, the neurosurgeon you mentioned, not supportive, but then a lecture he or the team gave wound up becoming a good moment for you that set the stage of your life.
Yeah.
And I love, we're a big fan of stoicism here at the podcast, and a lot of the things we share are about how, you encounter challenges in your career that then become, you're grateful for those challenges because they've set you on a new path, or the process of overcoming that challenge helps you succeed even more beyond what you thought, which is clearly the case with you. So can you tell us, once you became a surgeon, you were still interested in nerve. Can you set the stage for like what your pioneering work in nerve allograft has been? Because I think that's one of the things our audience loves to hear about, people who are so impressive like yourself. How did you make your discovery or do that first successful allograft?
I was in plastic surgery at the University of Toronto. And I actually wasn't that interested in plastic surgery, but I was offered a job in that. My husband offered a job in vascular surgery, and both needed a job. So off we went there. And I was going to do microsurgery at Queen's University, and I wanted to work with a guy named Ralph Magdala, who'd done the first free taking a muscle from the leg and putting it in the forearm transfer in North America to get back hand function. And I manipulated as much as I could so I could, in January of 1978 or something, do a 6-month rotation with him at St. Michael's Hospital. There's 6 big university hospitals at the University of Toronto. I worked so hard to get that rotation. I was so excited. I arrived there at the end of December, and on January 1st, they moved him to the Toronto General Hospital, and he wasn't there. And I was so disappointed. But there was a guy named Alan Hudson who was chairman of neurosurgery, and he had trained in South Africa. He was a marvelous surgeon, and he was one of the 2 people in North America that owned the area of nerve surgery. Dave Klein, his best friend, LSU, and Alan Hudson in Toronto. And I like to say that they were both each other's best man at their marriages. They were that close at Alan's 1 marriage to his wife, Susan, and at David's 3 marriages. He was the best man. But he really took me under his wing, because I was down there at St. Mike's and like all this free time, this guy that was there, his private practice in the afternoon, didn't want anybody like me hanging around with the facelift surgeries. So I hung out in his lab and in his operating rooms and his clinic, and he became a major mentor for me. I will say that the reason I came to Toronto was he decided that we were going to start a nerve center together, and this is now 1991. And he brought me down to the Toronto General, and we were getting going on it. And then came in December, and in February or January, he said, "Oh, I don't think I'm going to do clinical stuff anymore. I'm going to be president of the hospital." And March, Alec and I were in a ski line, my husband Alec, in a ski line at Whistler. And we said, we're going to leave. Like, I was going to start this center with him. And we were always going to start this nerve center. I was so excited about it. So he got wind that we were leaving. Actually, March at the ski line, we said we were leaving. And in August of that same year, we were in St. Louis. So bang. So, but in the meantime, talking about mentors, good and bad or whatever. So he was my mentor, and he still is my mentor. He sent me a copy of his beautiful book about his whole life just last week to edit and read. And it was wonderful. But he forgot the part about how he didn't want me to go. And he sued me for $500,000 for trying to go to St. Louis. And he had this whole full scap, and he had this person come and drop it on my desk, and I had to get a lawyer so he wouldn't. So, where do I have $500,000, when I'm 40 years old? But anyway, now we're reorganized again. So he gave me the idea. So here's what good mentors do. They give away ideas because they are seasoned and they know what the big pictures is. And they give you the idea and they don't hoard it back again. It's not like giving it and taking it. So he said, when I did a fellowship with him and then worked with him for the 9 years in Toronto before I came here. But the idea was nerve allotransplantation. No surprise, because in the beginning of the 80s, you had cyclosporin, and then FK506 was available, but just experimental. And that's when people started doing the transplants, the kidneys and the livers and the lungs. Like my husband was there for the first scrubbed on the first single lung. And he did research work for 2 years in the lab to facilitate the double lung, because for diseases like cystics and pulmonary fibrosis. It's a bilateral lung problem. And if you do a single, then you'll just infect the donor. So he did the work on how to keep the trachea alive. And he did the first double lung in Toronto. So that is part of it too. So I could do the nerve allotransplantation, just basically acceptating all of the stuff that they did in the lab on lung transplant into nerve. And we did the first nerve allotransplant and several of them. But well, at the same time, I had this lab. And as we were working in the lab on all of this, we started to like, oh my gosh, what? As the nerves got longer, they started to fail. Ugh, that was depressing. And I was left sort of with this, what? We were going to do longer and longer allos. We were going to take the whole plexus out, vascularize it. It was just going to be fantastic. And then we realized, well, what's the point? Because when you expand the length, you get failure. But then that failure led to nerve transfers where you'd have an injury up in the brachial plexus, for example. And what we were doing was harvesting both surals to put in these long grafts to reconstruct the plexus, and then wanting to do allografts. And then in the lab, we were seeing, well, things are starting to dwindle. You're getting Schwann cells that were becoming senescent, and they were producing a situation where it would just stop regeneration. So that actually was that failure. Failure was the impetus for something better. And that something better was nerve transfers. And that came from working with Alan Hudson, who was this guru in nerve graft, but at the same time working with Jim Murray in Toronto, where he was taught by Bill Littler from New York, who was taught by Sterling Bennell, who started hand surgery. So as the fourth generation of that, that was all tendon transfers, and Alan Hudson was nerve graft. So why wouldn't Susan Mackinnon take the nerve from the nerve graft and the transfer from the tendon and just go proximal a bit, and instead of taking the tendon over, come up and find the nerve and move the nerve over? And that was and remains absolutely out of the ballpark successful.
That's awesome. That's a great story. And I love, again, the themes you've touched upon of creativity and how you get ideas from here and there, and the timing is right with, immunosuppression coming to the field in the 80s. Very interesting. Two other surgeons I was able to work with at Hopkins directly, or interact with directly, Dr. John Cameron, who I know you know, Andrew Cameron, his son, introduced you, our director of surgery, and he helped perfect the Whipple procedure for pancreatic cancer, for our audience who doesn't know, and Dr. Patrick Walsh, who helped figure out how to do the modern radical prostatectomy with sparing the neurovascular bundle. And I had the chance to be in clinic with Dr. Walsh and learn, he's 86, he's sharp as a tack. I'm very impressed with people who've had multiple decades worth of contributions like yourself as well.
He's in clinic at 86?
At 86, he's not doing surgery anymore, but he did. I saw 4 patients with him last week. He'll be wrapping that up, but still doing research.
When I'm older, I realize that cultures and climates that are really special, they treat the young and the old very well.
Yes. Yeah.
So that's a good story to hear that.
Oh, it's wonderful. I've benefited personally from a lot of people in their 80s who've mentored and stay sharp. One quick story I think you'll appreciate is Dr. Catherine DeAngelis. Do you know who that is? She was the first female editor-in-chief of JAMA. And
oh, great. Yeah.
She's at Hopkins. And a decade ago, I asked her for some advice as I was leaving school to create Osmosis. And I asked her if she was retired. She was in her mid to late 70s at the time, I think. And I said, "Are you retired, Dr. DeAngelis?" And she said, "Shiv, honey, I never tired the first time. How can I retire?" And I think that's a theme for people. I assume.
That's lovely. I'll take that.
Yeah, you should.
I was never tired the first time. Why should I retire? Oh, that's beautiful.
Well, I want to ask you about yourself. So obviously, you have the right combination of mentorship, hard work and skill, and probably some ambition. Would love to hear, what does it take, in your opinion, to do something as pioneering as you've done? Like if someone's listening to this and wants to make a mark on the field.
Oh, that's a yummy question. Fantastic question. I have the answer. And how I have the answer is, oh boy, doing something new. If you're doing something new, even if for the people on this listening, if you're even at the podium presenting something and you don't get any questions, it's usually almost always because this is new and people are thinking about it. If you talk about something simple like gallbladders or carpal tunnel or something, everybody's running to the microphone because everybody's got an opinion. But when you're doing something new, whoa, and then really knew you are definitely ruffling the feathers of the people in the old paradigm. I didn't know about paradigm shifts until I was in the middle of it, going from nerve graft to nerve transfer. And there's a book by Thomas Kuhn on the scientific revolution. And he quotes Max Planck that says, no one from the old paradigm is going to buy in. Just don't even go there. They just have to die off, and new people have to be born into that paradigm. And it's a revolution, it's a crisis, and it's chaos. So when I was going and introducing nerve transfers that came to me because of that story, and then having this lab where I could test everything, but it hit people soccer punch, and they were angry, and they were, then of course, powerful women and Black males can be perceived as scary in our culture. And so there was a lot of pushback. It wasn't very nice. I reached out to Hannah Malacy, who had been the first to push the paradigm in nerve grafting from nerve repair. He gave me some wise advice and told me how rugged it was then, but I studied it. So when I started, when we get around to this climate and culture change business, I studied it. I studied myself, and I studied the situation I had myself in. But when I was paradigm shifting from nerve graft to nerve transfer, it was brutal, and I studied it. So I know the answer because I studied it. So if anybody has pencil and paper, the Thomas Kuhn, Kuhn, scientific revolution, so you know what you're up against, because it comes to you. It comes to talking to you. I didn't even know I was doing nerve transfers until one of my residents said to me in early 90s, Dr. Mackinnon, you don't do many grafts anymore. You're doing all these transfers. And I didn't even name it. So Thomas Kuhn, and then of course, Anders Ericsson, Carl, who he went by, who was the ideas that were the outlier, great book, but all pretty much Carl's Anders ideas about how you need a coach, you work hard, and you have deliberate practice. And then Steve Johnson, who wrote Innovation Where Good Ideas Come From. So I'll pause on that, because when I read that, and it's interesting, I had to give a talk on this shifting for a friend of mine. He was president of ASRAM, Keith Brandt. That's the Micro Society. And I was going to talk about this, and I remember opening up Time Magazine like 3 weeks before I give the talk, and they're talking about Steve Johnson's book, which is basically fantastic, gives me all this information. So all these things came to me, like Kuhn's book was given to me by a friend of mine, Bill Kuzan, and Anders Ericsson. I bumped into him at a meeting that my husband was running in North Carolina, and he was there as the speaker. And at the same time, there was an article about Carl in Time Magazine, and there was this write-up about Steve Johnson. So when I read it, 6 things that I've pulled out of how you innovate. Adjacent possibility. So you can have an idea that's a great idea. There were nerve transfers in the textbooks, drawings of it in 1911, but an idea before its time, because the adjacent possibility of microsurgery and instrumentations and magnification wasn't there. We weren't even allowed to touch the nerve then. Let it go inside. And when you went inside, that's one of the things that I did. I went inside. No one had ever been there. And when I got in there and I could stimulate in the middle of these fascicles, if you stimulate the radial nerve up at the shoulder, you can pull out thumb extension. It's just like, wow, going inside a nerve. Couldn't do that in 1911. So it was an idea before its time. So adjacent possibility. And then also he talks about pushing to the boundaries. And the next thing is having a group of people that, like a level 6, when I talk about Bruce Schneider's 7 levels, level 6 is connection. It is happiness and joy. It's oxytocin. It's seeing yourself in everybody. We're all the same. It's everybody's head at the table. And that's when innovation happens. That's when you're your wisest self. He talks sort of about that. Serendipity, like this crazy nut. The serendipity coms from the Prince of Serendips, 3 of them, and everything they touched turned perfect all the time. So you need that serendipity. And then it's slow. And that's another message for the audience. It's slow. You're talking to someone who's been doing this for 40 years. It's slow. And the other biggie that I talked about, lots of failure. So accept failure immediately. It took me a while to learn that. I remember one of my guys working with, he said, are you ever going to give up that idea about the allograft where blah, blah, blah? It made such sense. I got to give it up. You're right. It doesn't work. Okay. So accept failure immediately. Don't resist it. What you resist persists, and that'll get you going. And then the last book, can't remember what the last book is. I love that Steve Johnson so much. Oh, I know. Sure. It's the David Logan's book on tribes.
Oh, yeah.
And tribes are basically the same thing as Bruce Schneider's 7 levels. It's self, ego, needy human, doing human, and then being a human. And then the level of being a human where you're connecting with other people. And then you move past that into the biggest connection where these ideas are just given to you, just a gift because it's coming from the knowledge that is the creator's knowledge. And all of a sudden it just lands in front of you.
Oh my goodness, I love that. You're speaking my love language of books. Like all these, I've only read 2 of those books you mentioned, so I gotta go back and look at it. But thanks for like, who needs Blinkist when you just summarized one of these books?
Another great book to write down is Rick Rubin's book.
Oh, that on creativity?
Yeah, on creativity and being.
Awesome. So I haven't read it, but I've seen it.
It's terrific. I'm doing my second edition of my book, Nerve Surgery, and I have to do a preface. And the moment I have to do the preface, I watch Anderson Cooper on 60 Minutes, and he is interviewing Rick Rubin. And the next day, on Monday, I'm in the airport going to see the Vermeers in Amsterdam with my husband for our 51st wedding anniversary. And there is his book. And all the way over, I'm reading his book. And basically, his book is my preface. And it is How to Be Me is live at these high levels of energy and do not get sucked into the low levels of survivor brain where it's all about you. Ego, I lose, I win, you lose. Nothing happens there. But having been there for 2 years, or rather put there for 2 years, that's how I came to talk to you about culture and climate. And that's what I talked about at Hopkins when I talked to the Department of Surgery at Hopkins, where it's just separated. This is not my quote. This is John Dirk from Duke, said that surgery is only separated from a cocaine addict by 5 generations.
Yeah.
And I'm in there. I'm in those mighty halls to talk about culture.
Yeah. That's hilarious. So let's turn to culture. You said this on the Grand Rounds, and I wish we had that recorded to be able to share with our audience to look at. I'm sure there'll be.
I'm going to record it. I gave that as the Olga Johansson lecture by the American College of Surgeons, and they have it recorded. So that
on YouTube.
Could be something. But if they let it outside of the ACS, but really, I love talking to you because I want everybody to know the tricks of Bruce Schneider's 7 levels. He's taken the philosophy and all the great religions and all the wise thinkers from, soup to nuts, from Buddha to Jesus Christ, Mohammed, just everything, and brought it into an easy for surgeons or medicine people, anything to be able to have an awareness instantly in the moment, every moment of whether they're being a needy human where nothing happens except you basically kick up the adrenaline and cortisol and you're going to twist off your telomeres and get old earlier, just stress yourself out with all these inflammatory things going on, to the doing where we're looking after our patients and our families and we're, problem solving, to the being where they're really the human being at the 6 and 7, where all of the neurotransmitters like the oxytocin and the anandamide is the neurotransmitter for bliss, which is like flow 7. And that comes from the Sanskrit word ananda, which is bliss. So yeah, I want to teach that. And I want everybody to have that. So I will make a short little something for you you could tag on to this.
We'd love that, and I'm going to ask you a bit more about it too. But what got you interested? Like, so obviously you're pioneering nerve surgeries, nerve transfers. What is your hero's arc to getting into changing the culture of medicine through the things that you were mentioning on the talk at Grand Rounds? Like, talk to us about kind of the breakdown moment, if there was one, and then the rebuild from there.
Yeah, for sure. So Colin West, Mayo Clinic burnout. He wrote a white paper on what we should be doing for wellness. And in it, he says leaders should be vulnerable and practice self-compassion. So if I believe in that, and I do believe in that for wellness, I will tell you this story. And I was interested, about how they treat old people at Hopkins versus how they treat the elders at the institution I'm at. And I don't think it was just because I was powerful, but I think they had other plans for me. And so the leadership was harsh. And I don't think it was necessarily anything personal, but they just sort of had different plans for me. And I think really what it was in my life story, then the next part of my story was enter stage left, da, 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 and rough the heroine up and burn her out, and then we'll carry on. So it really was that. And then there's a short intermission for 2 years where I got out of level 1 and 2, this separated self, this going on, this survival. And interesting, it was during COVID as well. And I remember thinking, like, holy mackerel, Lord, I am not strong enough for this. But I studied it. I studied what it was like to be in those low levels where I had never been for any, except, when I wanted to, when I was marching for abortion rights in Canada as a teenager, and then, my pink hat later on and this kind of stuff. Like, I would be at the level 1 is I lose, level 2 is I win, you lose. But it's all those negative adrenaline and cortisol. And I was there for at least like 2 years, 3 years, something like that. And I studied myself, and I studied this whole situation. I was given by the institution these two great guys that coached me, but they said you have to give leadership in the hierarchy. Not all hierarchies and all schools are like this, but give them what they value. And they value power and control. And the third part is subservience. And this, give away my power and give away my control and be a servant. Like, I didn't really buy into that. But serendipity, a friend of mine who we'd done yoga, I made some yoga videos for her. She was opening up all the COVID, cardiac anesthesiologist at WashU. She was opening up these COVID units, and we sort of buddied up I was teaching meditation and some little things that the yoga by the bedside is all of her people were burning out. And she got into this. She had researched this IPEC, Institute of Professional Excellence in Coaching, IPEC. I thought forever as I was studying it that it was the Institute of Positive Energy Coaching. Bruce Schneider started it. There's like 10,000 people that have been trained by him or more around the world. And he really, I've never met him. I'd love to meet him because he has studied everything, like all the other people, like Eckhart Tolle and John Kabat-Zinn and Tara Brach and Pema Chodron and all the other people. He studied them, and he just put this in this very logical manner of basically it's what we know, stimulus response. So a thought drives a response. Default comes from what's going on in your culture when you're brought up, and then how your caretakers, your parents, whoever, who may even love you, but kind of give you these thoughts that just aren't helpful. So, and most of all of us, the thought is, I'm not good enough. Am I good enough yet? So that is you level 2ing yourself. Like, you don't win, you're not good enough. Everybody has that. And then moving up, level 3 is deep breath, accepting. Level 4 is compassion for our patients. We're compassionate for our patients. 5 is win-win, no failure. I teach at 5. If you do pimping, it's level 2. I know something you don't know. Now, there's no performance at 1 and 2, but as you go up, the performance increases and the neurotransmitters increase. So sympathetic nervous system, fight, flight, freeze, versus the parasympathetic, rest and relaxation, where you're really able to do anything you want. And then practiced and practiced and practiced and still practice how to immediately be aware when things aren't right, accept it immediately, dig in a little bit as to what nasty feeling you're feeling, take a breath, comfort yourself, you comfort everybody else, give yourself some, I'm now holding my arms. You don't have to do like shoulder to shoulder where people think you're an idiot, but you can just hold your elbows, and that is just comforting. Level 4 yourself, compassion for patients, compassion for you. And then you're right, the next one up, peace and calm, serotonin, ideas everywhere, opportunities everywhere, no failure. And right above that is oxytocin and happiness and joy, where you create. So I got into it because my whole life was that high level. And I rarely was at 1 and 2 until I was at 1 and 2 for a few years. And apparently I needed to be there. This whole thing, blah, blah, blah. It didn't just happen to me. It happened for me. And I am so grateful for that. I would not be talking to you without that. And now I know also this practice of loving kindness, self-compassion. It also is having compassion for the poor people that have to enter from stage left in my life to beat me up, having compassion for them. You're not going to change them. You don't have to set boundaries with them, but having compassion. Otherwise, you're caught up in this karma of negative spiral. And so that's my story. And I know that I talked for a long time, but I love telling you that story.
No, I love it. I think a lot of our listeners have either hopefully they've experienced some of this already, the need to get to self-compassion and go up those levels. But a lot of them probably are like, and have no idea what you're talking about because they haven't yet experienced that being at level 1 or 2 of being in constant fight or flight. I think, maybe the first and only time a metta meditation was ever done in Hopkins, in that room, was you leading it for the entire group of surgeons and residents and interns. Would love to just hear briefly, like, what does your own wellness practice look like day to day? Because I'm sure you go in and out of different things. You do maybe some yoga retreats, or there's meditative practices. Are you doing metta every day? Just love to hear kind of how you lead by example, because you're teaching this stuff. And one thing, as an aside, the breath work you shared from James Nestor, who was also a guest on the podcast.
Oh, lovely.
Yeah,
Oh, wow. Love his book. Love it.
Breath is a great book.
And
Yeah,
also the epilogue with the
actual practices.
pranayama practices.
Yes.
That was wonderful.
Yeah, that's the most useful part of that book, I think. When I say, if you only have time for one, just listen to that chapter and just try a couple of things in there. But yeah, what does your wellness ritual look like, if you don't mind sharing it?
My wellness ritual is different than it was when I started in 2003. My daughter got me into yoga, and it's different now. So I would recommend, if people don't have one, then to just, as you said, listen to the epilogue with the breathing practices and start with that. So all of the meditation is just to make you mindful so that you can be in the present moment, not otherwise in the default place, which is in the past or the future. So it's just whatever practices you do, it's kind of hooking you so that eventually you can be in the moment a lot. So my practice right now is being aware when I am not in the present moment. And Tara Brach, Brach, the sacred pause. It's like putting your finger on the pause button. And as soon as your finger goes on the pause button, you're at level 3 because you're slowing down. Tomlinson said, if you want to take a fast reactive medicine, then you should slow down. So if you want something to help you quickly, slow down. So by recognizing those fight, flight, fear, anxiety, fear, sadness, anger, as soon as you recognize that, you pause. And in that moment, you slow things down. And in that moment, you investigate what you're feeling and what you're really feeling. And then you ask yourself, can I sit with that feeling? And then you sit with that feeling. And then you give yourself some compassion. And that's level 4. And then now that you know, because you know that you've memorized these 7 levels, it's not hard. Thought, emotion, action, 7 levels. So now you've been level 2, you go to level 1, you might go to level 2, you stay at level 1, you're in this cursed little dark spot. Take a breath. Okay, I'm at level 3 now. You pause there and you investigate what you're feeling. And as you say the next rule, this is Tara Brach's rule too. As you say, what am I feeling? What am I really feeling? And what important thing has been crushed or compromised? What value? What do I value? You're pausing. And this can all happen very quickly. Pema Chodron says you can get a good enough slow down to not be reactive with the default response with 3 slow breaths. And she has a great little book called Leap, also a great book on meditation. So I would definitely recommend her, Pema Chodron, Chodrun, on meditation and Leap. So you slow yourself down, you give yourself that compassion, and then you're at 4. And then right above you is peace and calm, where there's only something to learn. So my practice is that it's moment to moment to moment now. I definitely just love sitting for 20 minutes, seeing how reactive my head is, how I can shift my awareness wherever I want, so I have control of that, and really trying to find the present moment. And then below the present moment, doing these things like, okay, I'm just this wave on a big ocean. This is all the nonsense of our lives, but I'm sitting as on this top of this presence which is huge, which is actually the divine creation of everything, and just floating in there. And then doing that breath to become sort of dissolving my whole body into this big area. So, and I do yoga every day in the front hall. I have my yoga mats, but I think the takeaway would be, oh, go and do something. If you're even saying, I think I want to explore it, but basically all it is really hooking you in so that you have the mindfulness of what you're feeling and sitting with that. And then you add the compassion, self-compassion of level 4ing yourself. So you're going to be okay. Sit with that. You're going to be okay. Are you feeling better? No, not really. Oh, let me hug you a little more. Let me give you some compassion. And then you can say, okay, I feel all right now. Well, then how about we just get it up to that level 5, peace and calm? What can you learn here? There's no failure. There's just opportunity. And there's lots of serotonin. There's no anxiety if you're on this dose of neurotransmitters of serotonin. Yay. So, and those neurotransmitters are so delightful. And the adrenaline and cortisol is so not delightful. One other quick thing I would say is fun to know is if you want to show that this works, you can mouth breathe so your mouth is dry. We all tape our lips, right? So that we do what James Nestor says now. But you mouth breathe so your mouth is dry. And then you start to do inhale, slow, 1, 2, 3, 4, 5. And then exhale, slow, 1, 2, 3, 4, 5. You can do the box breathing. You can stop at the top between inhale and exhale. That's a nice area to hang out. You're in between the inhale and the exhale. What is going on there? I think it's a real quick way to get to the portal of 7 is to sit between the inhale and the exhale. But when you're holding your breath or exhaling, you're driving the parasympathetics, which will also increase your salivary glands. So you can get this as physicians, you can get this awareness. This works. I'm getting all this saliva in my mouth as I'm just doing nothing but slowly inhale, holding, slowly exhale, holding, slowly inhale. Inhale is sympathetic, but you're doing 25% of sympathetic and 70%, 75% of parasympathetic. And then the saliva is going, and you know what's happening. And you know you're downing the cortisol and adrenaline. And you know that when you're at the level 1 and 2, you are at the survival brain. You are fight, flight, freeze. This is limbic reptilian brain. And if you want to do well in your exams or your in-service or your boards, you're not going to do well if you're fight, flight, freeze. So you need to do this, if only explore it, if only if you want high performance in every aspect of your life. That's the only reason for you actually to listen to any of what we're talking about or read Bruce Schneider's book, Energy Leadership. Oof. But if you want some high performance in every part of your life, this is the trick. It works. And I am so grateful, like I said, for living in the desert of the burnout of those few years. I'm grateful for that. This is my mission because I do know I have studied also Roger Everett talked about diffusion of innovation and the tipping point. Yeah, the outliers came from Anders Ericsson and the tipping point came from Roger Everett's book, where the tipping point is when you get 14 to 20% of the group to think this is a good idea. If you don't, it's an idea before its time. It's like nerve transfers in 1911. But if you get to that critical 15, 20% of the group buying in, we've got 60 some percent of us burned out. Those people, we have it. The only problem is that the hierarchy in some situations is there's retaliation if you complain. And so, but here's the thing. I'm untouchable now. I just care so much about this that I don't care about somebody saying bad things about me or, kicking me out or taking away my this or that or whatever, because this is in my mind. You can close my lab. You can take away the people working with me. You can take all of this stuff away, and you can't take away what's in my head and in my heart. So this is something I can do. And I'll tell you, like rapidly, like talking to people like you, who one of the first things you said is scale it up. You can scale this up. You can get Bruce Schneider on your show and scale it up and save the world because we need physicians. 40% of medical students now are not really interested in practicing clinical medicine. So this is trouble. And also with the Balanced Budget Act from 1997, where no more slots for trainees, and the population in the United States going up like this, and the number of administrators going up 3,500 in the same period of time, no more physicians. We need to change the culture and fix the climate and get it to a point where you can take the Hippocratic Oath, which says, if I don't agree to look after the care for prince and slave alike, I should die. If I don't follow this oath, I should die. So we need to get back to that. This is a way to do it. It's only 7 steps. You have to memorize a few things and then off you go. And then you'll find it yourself. You'll find your practice yourself, because these neurotransmitters are so lovely. And the results from living at those levels are so wonderful in every part of your life that you want that. That's what you can be addicted to. Your own serotonin, your own endorphins, your own anandamide, and your own oxytocin.
I love it. I mean, again, one of the reasons I knew I had to invite you to the podcast right after your talk and some of those things you shared on slides over the course of the Grand Rounds was because you're super credible. Like the things, I've heard some of these messages, and many of us have heard them from, what people would call hippies and stuff, right? Like it's derogatory, but like there's so much wisdom there. But the fact that you've already achieved the pinnacle of what people who go into medicine want to achieve in terms of pioneering surgeries and publishing thousands of papers and having labs and having tenure and all these things. And then you're able to also come to this from a personal, but also research perspective. And I've never even heard, like I've meditated and done a lot of breath work, but I've never even heard the idea of seizing upon your salivary glands to see if physiologically, if it's actually working, which is a cool thing that comes from listening to someone like you who's combining your medical expertise with your East meets West kind of medicine that you're doing here.
Can I have another 3 minutes? Because there's other thing I want to tell you. But what idea level 5 came right now, this idea, talking level 6ing with you, connecting with you, and then dipping down a little bit into level 5 ideas everywhere, is that get a load of this. I like the idea of taping my mouth together. My husband thinks it's great. I tape it and I say, I'm going to tape my mouth, Alec. Is that okay? Anything else you want to talk about? No, go ahead. Tape your mouth. This is good. So I had dry mouth and it really bothered me. So and I'll tell my patients, you go on nortriptyline for pain, you'll have dry mouth and have mouthwash or water by your bedside. So when I tape my mouth, you don't have dry mouth. And I'm wondering if that is having all that saliva moving around there, if that helps the parasympathetic by actually the breath. Hello, we should ask James Nestor that. But should we all be taping our mouth just so we don't go to the dry mouth, so we can really make our saliva happy with the parasympathetic stuff? But can I tell you, this is what I want to tell you, then I promise I'll stop talking.
Yeah.
So in 2015, this is serendipity, it's the whole story. 2015, I was going to the nerve and hand meeting in the Bahamas. And I got on a plane and there's 3 seats and I'm sitting here, another woman's sitting here, and there's someone in between us. And we were sort of talking and I said, oh, so what are you doing? And she said, well, I'm going to the Bahamas for my 50th wedding anniversary. And I said, by yourself? She said, no, my husband's over there. And I said, okay, well, we hadn't taken off. I got up and I asked the woman sitting beside her husband if she would, and she was in a center seat, would you come and sit with me so she can sit with her husband? It's her 50th wedding anniversary. So they do that. The woman sitting beside me was another change your life person in my life. She was like an angel coming in my life. She's from California. She was going to the Bahamas too. I was going to this place called Paradise Island, which was really like not well named, but just down the beach about like maybe a quarter of a mile was this ashram retreat, yoga retreat that had been there for 46 years. And she was going there for a week. And her job was, was a psychologist for child trauma. And she sat beside me and she told me about this book by John Alexander. And she also was talking about how you can manifest. And that's what John Alexander kind of talks about. But the woman beside us, she sort of got in our conversation, and her husband had just more than 50 years, had just passed, and she was going to the Bahamas to try to recover a little bit. So the two of us, this woman who's just lost her husband and me, who's this, I was worrying about my grant. It was January. I was going to find out in February whether I'd get my NIH funded. And I was 65 years old. But anyway, this woman helped both of us. She's remarkable. So I get to the Bahamas, and this place I'm staying at, to get to the meeting in your hotel, you got to go through casinos with smoking and lights and noise, and it was like horrible. So she invited me to go down and do yoga with her. So I go down to the beach and I'm doing some yoga at their little ashram thing. And then there's something going on with this very thoughtful person talking. And I'm coming back to my hotel. It's late at night. And well, not that late, but it's dark. And I sat on the beach and I did what John Alexander says in his book, which is Proof of Heaven. He's a neurosurgeon and he had a stroke and almost died, but didn't, went to help heaven and came back. But he talks about, and so do lots of people, like everybody that talks about it, talks about how to manifest, like totally talks about that. You put yourself in the future and knowing in the future exactly how you're going to feel. And then being like, literally being there. So I said, okay, I want this grant funded. And I was still wondering, why do I care about why am I so attached to this? Like I'm so accomplished. When can I skid off this? Like, blah, blah. So I sat on the beach and I thought, okay, I do want the grant. And I sat there and I thought, what will you feel like when it gets funded? And I felt great. And then I asked, then you're supposed to ask yourself, and why is it really that you want this grant funded? And put yourself there and ask you that. And you know what my answer came to me? So I can talk about things that I care about from the position of being a neuroscientist, and people will listen to me. And I burst into tears on that beach in the dark. Exactly what you said. Like I can be credible because my H index is off the charts. And I got 700 publications and like 30 years of NIH funding and 10 years of MRC funding in Canada. I'm smart and I have focused in one area I'm passionate about. So I have accomplished a lot of stuff. And I'm married to Alec Patterson, who is more accomplished than I am. You should have him on, more accomplished than I am. So I don't have to, like, I'm free to do what I want to do. And I've been blessed with 4 kids that are wonderful, that are around play all the time. I was around play, level 6 play, and now I'm around 11 grandchildren, level 6 play. I have been so blessed, but that was a shock to me that I knew I wanted it, but I didn't know why. And then when I did that manifesting, as John Alexander talked about at the end of his book, he talks about it. And I said, why do you care so much? And then it just came to me from level 7 for sure. So I can teach this to other people so they don't have to suffer in pain and suffering and fear and anxiety, because I know how to be up there. But here's what I didn't know in 2015, 16. I didn't know what it was like to be down there. And I got that as a gift in 2018, 19, and then right crazy that like the fires were burning in 2021. Oh my gosh, it was nuts. It was so nuts. It was so horrible and so nuts. I couldn't even believe it. But now I know I needed to get down there in order to be able to be there with people that are there, that I've been so privileged in so many ways, every way. So that really resonated when you said you can talk about it from credibility. Yeah.
Wow, that's a great story. I mean, and certainly those type of stories stick with you. And I would say that self-awareness is a key theme. Like, we all do these things, and without recognizing that the things we do are often just desires that society or our parents or someone else places on us, or just, you're on a treadmill and there's momentum, right? That's why a lot of people wake up one day after 10 years of practicing and realize they actually didn't want to do this exact thing the entire rest of their life. And fortunately, that happens to them. They have the breakdown to break through. But I've already taken you way over the 30 minutes. So just to kind of bring this to a close, and obviously we'll have a continued relationship and keep sharing your content. I guess two last questions I had for you. One is, this whole podcast has been full of advice and book recommendations that you've given our listeners. So this may be a very redundant question, but I have to ask because I'm sure you've answered this many times for your own children and grandchildren and your trainees. Just what are some of the key pieces of advice you want to leave our listeners with as far as, approaching their careers and lives? You've already shared a ton, but are there things that you'd like to share that maybe we haven't gotten to yet?
Well, okay. I'm glad you asked me that. I was kind of hoping. So I have mantra boards. Greg Kelly, who's an artist in Virginia, made these for me. This is my first one, and it is Non Carborundum Illegitimus, and it's got my dad's little signature here, Donald Lachlan Mackinnon, and he gave me that when I was a teenager. known carborundum illegitimus, and it is sort of pig Latin for don't let the bastards get you down. And now I know it is don't let people that level to you get you down.
Huh.
And when he told me that, I don't even know. I don't know. It really stuck with me. I don't even know why, but he told me that. The other thing I do remember he told me, though, was when I had 95%, he asked me where the other 5% went. And I remember thinking, that's weird. Come on. I'm like top of my class. And you're kidding, right? But it stuck with me. So that message stuck with me. And you're like that not good enough kind of thing. Or are you good enough yet? So here's the big thing, though. A big thing is we have given that message from people that love us that we've got to do well. And we interpret that as we aren't good enough yet. You're not good enough. And we have to be like that, very oriented towards accomplishing something and outcome related. That's very level 1, 2. And then we have to stop doing that. So it gets us, those books were saying, take you here, but not there, or you go far alone, or go fast alone, go far together. So this level 2ing that we do ourselves from the culture and the people that love us, we have to be aware of that and stop it, because it got us here and it is not going to get us where we want to go. And then so that was that. And then 2006, I got this mantra, which is do the best you can, let the rest be done for you. So do the best you can. This is Greg Kelly's work again. Lovely. Do the best you can, let the rest be done for you. I got that in 2008, when my sister was here and she had some medical problem, and I was just exhausted and she was exhausted. I went for a yoga class and I wanted an active class. It was a yin class. And I thought, I got to get out of here. And the teacher said, do the best you can, let the rest be done for you. Same thing. Do the best you can. You get into the positions we're in because we did stuff, and then let the rest be done for you. That's heresy, but that's important. Let the rest be done for you and say thank you. And then in 2018, when I started to suffer, I said 2018, it sort of started forward, fearlessly, courage, curiosity, and trust. These were my 5 words. I could, like Rumi, I couldn't add anything to it or take anything away. That was his definition of beauty. So forward, fearlessly, courage, curiosity, and trust. That's my advice from 2018. And 2022, it was, oh boy, that was, now I've been through this burning out thing. Find joy, be kind, do good, reject mean. Find joy, be kind, do good, reject mean. And now last year, it was this message that just came to me. And that was, not only am I good enough, Susan, you're blessed. And then I don't know if I heard the words act accordingly, but yeah. So those are my wisdoms. That's it. But those are the things that are important to me. So we're all blessed. The other voice said, not only are you blessed, Susan, everyone's blessed. They just don't know it. So I would say everyone's blessed, and knowing you're blessed, act accordingly.
Wow. You are the first guest we've had who not only had great concise advice, but also the time, like when it came to them, why it came to them, the stories, and then also actual like a slide presentation. I feel like we normally just do this audio only, but I feel like we should post the video just because you went through that. So that's great. I mean, and again, so much advice is contextual, but you've provided the context for why you are giving it. Because I think a lot of people who give advice, they assume that it worked for them, it's going to work for everyone. And that's not the case with advice.
That's sort of like mentoring, and so you can, but coaching, which now I'm a certified coach from Bruce Snyder's IPEC, the coachee has the expertise. All you do as a coach really is just give a space for them to start thinking about these things, because they're so busy, they never do that. It gives them a pause. Being a coach is really just putting your finger on the pause and then letting it go.
Absolutely.
So I'll give a shout out. If anybody has mantras, and they want a mantra board, Greg Kelly in Charlottesville, Virginia, our artist friend, he can make them up. You can have your little pile of boards too.
That'd be great. Maybe we can get the link and post that in the show notes.
Well, he would actually be a good person to be on a podcast. I think he has done podcasts. He's quite a character.
We'll take a look. That'd be cool.
An artist, right? They're very creative. They're in the same kind of plane. The creativity is level 6. Okay, I got to let you go. This is ridiculous.
Not at all. Susan, thank you so much. Really, really pleasure to have this time with you. And also on the, once we have your video, we'd like to share it widely. So thanks again in advance for that.
Great. Thanks for doing that. All right. Let's get to that 20%. Change the culture, change the climate. We'll all be happier, and the hospitals will make more money, not less.
And with that, I'm Shiv Gaglani. Thanks to our audience for checking out today's show. And remember to do your part to raise the line and strengthen our healthcare system. We're all in this together. Take care.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.